Hello, my friend. Today, let we talk about hematology. Hematology as a science that study blood and blood forming organ. So, in blood, we are having cells and plasma, whereas in the cell there is red blood cell, white blood cell, and platelet. All of them they can have abnormality, but abnormality of today we're going to look on is red blood cell abnormality, specifically megaloblastic anemia. When you understand megalo, it means you're going to have macrocytes. It means that the cells they are going to be enlarged in the cells, specifically in MCV. Red blood cell will have more than 100 femtoliter. So normally we are having several kinds of anemia. This megaloblastic anemia is called macrocytic anemia. Normally on the peripheral blood smear you're going to have the notochondrial abnormality of red blood cells, and each cell with DNA they are going to have abnormal shape, like here see this is segmented neutrophils and so on and so forth. So before you dig deeper megaloblastic anemia, normally several types of anemia are happening due to the problem in hemoglobin synthesis. So if we talk about iron deficiency anemia, or the sideroblastic anemia, or the thalassemia, or the problem are here in hemoglobin synthesis, where like sideroblastic and sideroblastic anemia, protoporphyrin 9 is not synthesized, then iron is accumulated in red blood cells. That's why we have the sideroblastic ring sideroblast. Also we have iron deficiency anemia. When you don't have serum iron is decreased, and even ferritin is decreased. So thalassemia, the problem is in the amino acid or protein called globin. So if the deficiency is alpha, this is called alpha thalassemia. If the deficiency is beta, this is beta thalassemia. So means any kind of the red blood cells abnormalities where hemoglobin is not well synthesized or DNA is not well synthesized, they are going to manufacture as the anemia, where you're going to have the some features here of megaloblastic anemia. But remember, megaloblastic anemia, nothing to say here on hemoglobin synthesis. The problem is all about DNA synthesis. So here there are like some features of megaloblastic anemia, but you will have time to look on the peripheral blood smear. This is, as I said, large over red blood cells, which is abnormal morphology, and even the platelet having segmented lobes nucleus, where normally the normal neutrophils is supposed to have less than 5 lobes. So I'm requesting you to do what? Subscribe so that you can enjoy in this family of Dukunimana Power. So I have a study of last video where this patient called John, if you are John, I'm sorry, is having rheumatoid arthritis. Not only rheumatoid arthritis, hemoglobin level you see is decreased, and even as you see hematocrit is very low, comparing that this man is male. MCV is normal. When you come to the biochemical test, like ferritin is severe elevated, but serum iron is decreased. So based on these clinical findings, if you read very well, you can have some error saying this is iron deficiency anemia, but you cannot say so, because if you see hemoglobin is not highly decreased, but the key point is here serum ferritin, which is increased. If serum ferritin is increased, serum iron is decreased, and normally total iron binding capacity also here is decreased. So normally this one, it is called the anemia of chronic disease, which is confirmed by ferritin increase, serum iron decreased, total iron binding capacity also decrease. So if you see the case study like this, don't lose marks. This is anemia of chronic disease because of those things I have said. When you come here, the story of today is called the megaloblastic anemia. Normally, this megaloblastic anemia are the anemia from impaired DNA synthesis, as I said. It is not a problem of the hemoglobin synthesis. The problem, it is all about DNA synthesis, means it is problem from DNA defect. So the causes, there are two things you are supposed to know: vitamin B12 and folic acid deficiency or folate. So if the B12 is deficiency or folate deficiency, any one of the two which is going to be deficiency, your DNA synthesis is going to be impaired, hence megaloblastic anemia. Normally, there is a special name when the B12 is deficiency, is called pernicious anemia. Please note this word because it's going to help you in your case studies or in your exam. So there can be either pernicious anemia when there is lack of intrinsic factor in stomach, which is secreted by parietal cells. This intrinsic factor, they help in absorption of vitamin B12 so that there is no megaloblastic anemia. Hence, if there is any deficiency of this intrinsic factor, there will be no absorption of vitamin B12. So even vitamin B12, they can be deficiency due to there is no absorption, is not happening properly, or you are not eating the food containing it. Normally, this B12 is rich in the animal product. When you go to the folate or folic acid, or which is vitamin B9, maybe is deficiency because it is not there in the diet, or there is a pregnancy. In the pregnancy, remember there are two people, woman and her baby. So if there are two people, it means it is increased in requirement. Also, those who are colonized by alcohol, they can have the deficiency of this folate and the drugs. So if we talk about pathogenesis means it is how this megaloblastic is going to occur. As I said, there will be DNA synthesis defect. If there is DNA synthesis defect, the cytoplasma will mature, but the DNA will not continue to mature. Means the red blood cell precursors, they are going to be, the nucleus are not going to be matured. Hence, there will be what you call nuclear cytoplasmic asynchronicity or asynchrony. So here, if there is this defect in DNA synthesis, automatically there will be ineffective electropoiesis. Means the way the normal red blood cells is formed is now defected. So which will cause what you call extramedullary destruction. Remember, in the spleen there will be a subtraction of RBC, and then in the spleen there will be the problem of high destruction of this abnormal red blood cell. Also in bone marrow there will be hypercellular with the megaloblast, because there will be those red blood cells formed are abnormal and they are highly destroyed in the spleen. That's why bone marrow, they will compensate by increasing the cellular inside it. So on the peripheral blood, we will have macrocytosis, the big cells, sometimes pancytopenia, because remember in even the red blood cells, white blood cells, all of them, they have nucleus. Red cells which have nucleus are the precursors, not the mature one. Mature one, I think on the reticulocyte, the nucleus is now extracted from them. But white blood cells, they have white blood cell, which means the red blood cell precursor and white blood cells, there will be abnormality because there will be no DNA synthesis. You can ask yourself, this vitamin B12 and folate, they help in the formation of the thymine nucleotide from the uracil. If there is no this vitamin B12 and folate, there will be no formation of the thymine. If there is no thymine, there is no nucleotide or building block of DNA. So here there are some features like fatigue, pallor, shortness of the breath. This is the common for all anemias. Glossitis also can be common. We have seen in the iron deficiency anemia. Also there is the angular stomatitis. But here on what we call the megaloblastic anemia, we will have a symptoms called neuropathies like numbness, ataxia, all of those things regarding to nerve system abnormalities. Please, it is called the B12 deficiency. If you get case studies and the patient is manifesting the things of the problem of nerve system, the problem you will say it is megaloblastic anemia, specifically vitamin B12 deficiency. If you want, even you can say pernicious anemia. They can be even diarrhea, anorexia, and mild jaundice. I hope you can understand. If you see this image, this is the normal RBC, but this one which is which is enlarged, this is called the megaloblastic anemia. So actually, let's continue. On the laboratory findings on the CBC, as I have told you, mean corpuscular volume it is going to be more than 100 femtomer. So there will be leukopenia, means decrease of white blood cells, thrombocytopenia. Remember, megakaryocytes also they have nucleus. That nucleus can't be formed without DNA synthesis. You're understanding why? So there will be increasing LDW, lactate dehydrogenase, which means there is severe increase of the RBC destruction and also indirect bilirubin. So on the peripheral blood smear, we are going to have macro-ovarocytes. You see, you will observe the very large, very big cells. Okay, this one is very big cells. This is called the macro-ovarocytes. Very important. You will have hypersegmented neutrophils, more than 5 rows. If you count here, you can count 1, 2, 3, 4, 5, 6, 7, 8. This is hallmark of confirming the megaloblastic anemia. There is anisopoikilocytosis. When we say aniso, there is variation in size, and poikilo, there is variation in shape. You see, this one is ovarocyte, this one is normal, this is lacking central parole, means there is anisocytosis, and the size. Poikilocytosis, the shape also, if you see, is changing. You can see also how bodies in even megaloblastic anemia. So let's come on a confirmatory test where you will check serum vitamin B12 and folate. If you see it is deficiency, automatically you will confirm that is megaloblastic anemia with deficiency of B12 or folate. Normally on the bone marrow, we are going to have the megaloblast, the cell which is very enlarged. And you can do also anti-intrinsic factor antibodies like for vitamin B12 only. So there is another test called the chilling test, but normally it is not highly used in the hospital today. I think we can go on the case study of this very important megaloblastic anemia. Normally this is neutrophil which is hypersegmented. This one is Howard-Jory bodies which can be observed. You can also observe teardrop cells and macroovarocytes, as you have said. So we can go on the case study of today. Please focus. We are having this 52 years old man presenting progressive fatigue. Okay, the progressive fatigue means maybe there is hypoxia in the tissue, oxygen is not reaching there properly, which can say it is oxygen deficiency. There is numbness and tingling in both hands and feet. This confirms that there is neuropathies. When you see very well, there is a parole mid jaundice. This one is normally common for the many anemias. So here, if you see, there will be neurological examination which reveals a loss of vibration and positive which confirm neuropathy. Hemoglobin which is decreased. MCV, very important. If you see MCV is more than 100, this confirms that it is megalocytes. What is remaining is to confirm other parameters. If you see white blood cells is decreased because the normal range normally is 4,000 to 1,100. To confirm there is pancytopenia, even platelet is decreased. Leukocyte also is very low. LDW is elevated, and all of this on the peripheral blood smear. there is macroovarocytes and hypersegmented neutrophils and occasional hoary jolly bodies. Now, what is most likely diagnosis? This question is like a piece of cake, please. Everyone can get the answer, but I can count 1, 2, 3. The answer is now very easy. Okay? Most likely diagnosis is vitamin B12 or megaloblastic anemia. Why? Because we are having numbness, tingling, the problem of neurology. This confirms that is megaloblastic anemia, specifically vitamin B12. So macrocytic anemia with pancytopenia, neurological deficiencies present. Also hypersegmented neutrophil is only found in megaloblastic anemia. But you have to consider with other parameters and the macroovarocytes on the peripheral blood smear. All of this is confirming megaloblastic anemia, specifically vitamin B12. Please, no one who is supposed to get 0 for case study of megaloblastic anemia. So I'm requesting you to do again subscribe for those who didn't, and I wish you good luck, all the best. Thank you. Bye bye.